special Amref podcast episode titled Bridging the Gap: How Kenya is Confronting Neglected Tropical Diseases. I'm Halima Sabwa, your host for today. Today, we dive deep into the world of neglected tropical diseases, NTDs, a group of diseases that disproportionately affect the impoverished and have long been overlooked on the global health agenda. In Kenya, these diseases pose a significant public health challenge impacting millions of lives in this country. Joining us today are our esteemed guests, Dr. Martin Muchangi, an expert in tropical medicine and public health specialist at Amref Health Africa in Kenya, and Chivitai Juma, project officer of county programs at Amref Health Africa in Kenya. We will explore Amref's approach and how it's making a difference in the lives of many Kenyans. We'll also be delving into challenges and successes of implementing NTD programs and discuss what more can be done to eradicate these diseases. Before we get into the podcast, tell us a bit about yourself, Dr. Muchangi. So, what's one of the funniest, most unexpected thing that has ever happened to you?
At one point, I made a silly joke. Mm-hmm. Yeah, I was at Schiphol in the Netherlands, and I was cleared by the immigration. I proceeded to the bookstore, and I went and asked the bookseller to sell to me a book entitled "How to Live in Holland mm-hmm. without a valid visa and without getting caught by the immigration." That was silly because the seller just called the immigration. Of course, I was called and interrogated once again. Now, there's a lesson around that, yeah? We don't take life seriously here in Kenya. But in Holland, people take anything that you say very seriously. So it's a joke, but at the same time, I took a lesson out of that.
But at the end of the day, you did not miss your flight.
No. Okay. Actually, I was arriving. So,
okay.
Yeah, all was okay at the end of the day.
Okay.
Yeah.
And Juma, if you could eat only one food for the rest of your life, what would it be and why?
Well, that looks like it's a tricky situation. Mm-hmm. But because it's one of the hardest things for one to pick a single food his entire life. Maybe what I could do mm-hmm. is to look at a variety of foods that would be able to give me a balanced diet and also offer nutrients.
It was one food.
Yeah. So if it's one food, then maybe I'll be able to do fruits that are cutting across mm-hmm. several nutrients.
Okay. Yeah. Like?
Maybe berries.
Okay.
Yes.
Okay. It's a good answer. Yeah, because at least berries have antioxidants. They have other nutrients that you can get as opposed to maybe like ugali, which is just a starch.
Yeah, for ugali it's just basically starch. And if you pick, maybe the others will be proteins. So you need to balance, but it's a very difficult situation because in long run maybe you may realize you are now lacking some specific nutrients, and then you may end up also in hospital.
That's true. That's very true. And because today's podcast is on NTDs and it focuses around and understanding NTDs in Kenya, my first question is for Dr. Muchangi. And what are the most common neglected tropical diseases in Kenya, and why are they termed neglected?
Yeah. So allow me to begin by giving a quick overview about what NTDs are. It's a group of about 21 diseases that the WHO has classified as neglected tropical diseases. They are called neglected tropical diseases because, number one, they occur within the tropics when you look at the group. And then, number two, they are dominant within populations which suffer poverty and lack of basic water sanitation and hygiene infrastructure. So I would want to say that indeed it's not the diseases that are neglected, but it is those people who are suffering those diseases that are neglected. Now, up to date, the statistics that we have, about 1 billion people are affected by these NTDs. across the group. And when you look at the Kenyan situation, statistics also indicate that all of us Kenyans are at a risk of about 1 or 2 neglected tropical diseases. But the key thing to know here is about 9 million Kenyans are having these diseases. So that's huge. It's about 1/5, like nearly 20% of the Kenyans are like having these diseases. Now, from an argument perspective, there are about 5 major neglected tropical diseases. The first one is trachoma, the blinding trachoma. And we see this happening largely around arid and semi-arid lands of Kenya. And this disease is spread by flies, in situations where keeping basic hygiene conditions is difficult. Then the second one is the soil transmitted helminths. In other words, minyo in Kenya, Swahili language, right? So these are intestinal worms, and they largely occur because of eating contaminated food with the eggs of these parasites. Then the other one is bilharzia, in medical or scientific term, it's called schistosomiasis, right? Now, there's also another one called the lymphatic filariasis or elephantiasis, and in Kiswahili it's called matende. It's the one which causes the swelling of the lower limbs. Then we do have another one called river blindness or onchocerciasis. So that's the other one. So in short, there are 5 neglected tropical diseases which each and everyone is trying to eliminate. And so Amref, the governments, and also the global communities have set themselves towards making sure that at least those 5 diseases are eliminated.
Okay. And Juma, how do NTDs affect the health and also the socio-economic status of individuals and communities in Kenya?
Yes, so thank you for your question. NTDs, of course, affect the most vulnerable populations within this particular country. And I look at it from 2 different perspectives, the health perspective and the socio-economic. So within the health system, the health perspective, you realize that these are probably diseases, and when somebody has a disease, there are various outcomes that can occur, just like any other normal disease. So part of the issues that arise from this, you realize that diseases like visceral leishmaniasis, if they are lately diagnosed within the population, because also they do not present themselves well to the clinicians, and they could be also issues of misdiagnosis, they could result to death. So there's an aspect of mortality, and several people have been able to have, this has resulted in several deaths across the country. The same entities, of course, can result in prolonged morbidity. Diseases like trachoma, you find once somebody becomes blind. Of course, if you diagnose in early stages, you can be able to do a corrective surgery and you reverse. But if it's in late stages, then the person becomes blind, and therefore they live with that condition forever. The same case if somebody gets a disease like elephantiasis, they will live with that condition for long. You get somebody having the extremities of the body. It could be the limbs or the genitalia, they are swollen. So you realize the person will be having disease conditions like hydrocele or lymphoedema. Of course, with the hydrocele, you can be able to do surgery, and then you correct. The same diseases, you find somebody also has issues around discrimination, stigma. So you get the disease, and you feel ashamed for having had that particular disease. You take a disease like leprosy that was even documented in the Bible. The person may be ashamed to come out. You find a disease like lymphatic filariasis, somebody has got the hydrocele and it's swollen. They may not be able to come out of their households to reach and interact with other people. In terms of socioeconomic impact on these particular populations, If this person is going to meet the medical cost for these particular diseases, then they are likely to dig deeper into their pockets, and this to an extent pushes them further into poverty, because they have to pay for these diseases quite some huge amounts. The same populations, if children are affected by worms and they are unable to concentrate in school, you find that their education levels will be able to drop. Some of them may decide to stay at home. There's increased absenteeism, and in Kenya we are looking at 100% transition. So you find that there are still some populations in Kenya which will be illiterate because of these particular diseases. When you look at it in terms of maybe the productivity of these persons, if somebody is affected by these particular diseases and maybe supposed to engage in socio-economic activities, be it farming, then they cannot be able to continue doing those particular works, and therefore it means even their income levels are affected. Maybe somebody has this particular disease, somebody was working and is affected by a disease that probably will affect some of his part of his body, and I like quoting probably like trachoma. If somebody was doing like you go to the marginalized population in the arid area, somebody was maybe making like beads to go and sell, and once they become blind, it means they can no longer engage in that particular activity, and therefore they are out of their routine activities. Maybe they were employed, and therefore it means that they will be laid off from their work. So those are some of the impacts that the communities are undergoing in line with these particular diseases.
And we've been talking about NTDs and how they impact people in society. So, Dr. Muchangi, can you tell us about Amref Health Africa's strategies in combating NTDs in Kenya?
Yeah, sure. And as I get to that question, allow me to paint a picture of the poly crisis that everyone in this world is facing. So right now, we are experiencing a changing climate. So climate change is becoming one of the major issues that is affecting the economies, that is affecting health, that is affecting talk of any sector, including the way we feel ourselves as a people. So the second thing, which is now very clear, is that we are having a lot of conflicts, and that is driving the global economy in a very negative way. Then the other piece is that we have seen epidemics and pandemics coming forth. So it's a poly crisis, so to speak, about. And when Amref Health Africa was thinking about how to program and moving into the future within its strategy, we asked ourselves the question of what were the pain points? And it came out very clearly that we are having a youth bulge. We have not been able to fight communicable and communicable diseases effectively. And at the same time, issues of social determinants of health, such as climate change, livelihoods, and issues of education are actually not fully addressed. So Amref Health Africa invited itself to address those problems by first of all, founding itself from the primary healthcare imperatives, making sure that we reach people where they are and in their very best elements. So for that case, from the broader perspective, our core mission is to address primary healthcare. But for us to do that, we have two mutually reinforcing arms. One which is to implement primary healthcare, and then the second one is to address the social determinants of health. In all that, we are so keen on ensuring that within the primary healthcare imperatives, we ensure that there is quality health services. We ensure that there is equitable provision of those health services. We ensure that we create health resilience. At the end of the day, COVID taught us that if we are prepared, then any other pandemic can really hit us hard and take away all the gains within the health sector. And when you come to the social determinants of health, we are so keen to ensure that we address the issues to do with livelihoods, ensuring that we have money in the pocket so that communities can be able to buy health. And then the second thing is what I spoke about, which is so dear to me. I'm so keen on ensuring that we create climate resilient health systems that don't proliferate the conditions of taking away the gains within the health sector. So addressing climate crisis in conjunction with health issues. And lastly, it's education, and education that ensures that, number one, literacy is infused or is taken up by women and girls in a way that they understand that nutrition is good, they are able to earn more better living, and at the end of the day, out of that, health is improved. So that's the way Amref is looking at the overall strategic initiative within the year 2023, all the way to the year 2030. We decided to align ourselves with the SDGs. But now coming directly to the NTDs, I would say if we implement primary health care at its best, then chances are we are going to eliminate neglect and tropical diseases, because one, we have already addressed the issues around the social determinants of health, and then we have already ensured that the people-centered health systems then address the issues of equity in access, quality, resilient health systems, and proper governance and accountability. Yeah.
Okay. And we've touched a little about what communities, the role of communities and how they can take up the fight against NTDs. So Juma, my question for you is, from a program's perspective, how crucial is community involvement in the fight against NTDs? And what are some success stories that you can give us today?
Yeah, so community is the integral part of the health system. And when you look at even the Kenya government currently, we are looking at primary health care, the UHC agenda, all those kind of facets that now, if you can be able to address health issues at the lowest level, then you can be able to eliminate part of these diseases. Remember, the NTDs are mostly found in the very remote areas of this particular republic, and therefore you need to tackle them from that basic level. And within Amref, because we look at issues around people-centered solutions, we work closely with communities, and we've been working with communities on these particular diseases for quite some time. One of the major issues that communities have been critical in this, and it's actually even ongoing right now, is that communities have been very critical in terms of treatment. When we are going to do campaigns, the mass drug administration, we are giving drugs at the communities. It's the same communities that administer this particular medication. So we utilize the community health promoters to distribute these medications to each and every household. And in this sense, we realize that we've been able to reach each and everybody without leaving anybody behind. The same communities are also critical, because in terms of disease surveillance, the information, the communities are the first people to know whether there are changes within the community. So they will be able to detect these diseases, detect sick people in the communities, and report within the surveillance system. And this has been picked. I know the last case, when we are looking at the last case for elimination in Kenya, the guinea worm, it is the same communities that were helping together with Amref and the Minister of Health, that we are looking for the latest and the last case that could be found for us to be declared as guinea worm free, this particular republic. The same community that we are talking about at the lowest level, they are also critical in terms of creating awareness within the communities, health education, so that people can be having knowledge to change their practices, their perspectives in terms of the diseases. And in so doing, even when we are going to treat these particular diseases, the communities are able to put in place systems for them to address these diseases. But of course, in long run, we are looking at the communities and these diseases and the government putting in place sustainable measures to ensure that the diseases are eliminated, because Amref will not be there for long providing these services to the general public. So what we are doing, we are working closely with the communities, the civil society organizations, to advocate even within the counties and the communities for resource allocation for these particular diseases, so that they are mainstreamed within the routine health system. And in so doing, you realize that in long run, we shall have been able to eliminate these particular diseases. So in long run, in short, that's how we are working closely with the communities. So the solutions that we are trying to craft are basically community-centered.
Okay. And Dr. Muchangi, what would you think are some major challenges in addressing NTDs, and how do you think Amref is overcoming them?
Yeah, sure. So, as we discuss the challenges, allow me to reframe the way Amref Health Africa is coming in to address those foundational issues that are making us not eliminate the diseases. In other words, the challenges. So, Amref Health Africa took to itself to think about the key things that if we do them, then we are going to address the underlying challenges of eliminating NTDs. And so the first imperative that we came about with, and actually they are enshrined within what we are calling 5 Ps, is P number 1 is people-centered health systems. Nothing for the community without the community at the center. And we are doing this by working very closely with the community health workers and of course the county government or the local governments. We are working with all the arms of the governments to ensure that the citizen voices are heard and they are used to program. They inform the programming, right? So that's the first P. The second P is redounding what Juma spoke about. That is public financing. There is no way we are going to eliminate NTDs without having the government investing directly to address the NTDs. And I'm so happy that we have started seeing the changes. Counties are now putting money within the press to deal with jiggers, to deal with the intestinal worms and other diseases. Okay. Then the third P is around appropriate policies, right? And I'm so happy that the Ministry of Health in Kenya and the global community at large has developed very sound policies, including the Kenya NTD Elimination Master Plan, which spells out very clearly the kind of activities that need to happen to eliminate NTDs. So policies is something which is very, very key. Then the other piece is around partnerships. This cannot be done alone, right? So partnerships with the private sector, partnerships with the government, and partnerships with the communities and the civil societies to ensure that the voice of the community is elevated, to ensure that investments are flowing in the right way, to ensure that innovations are coming to the table and taking that forward in a way to eliminate the diseases. Now the last piece is a very interesting piece, which is precision public health. As I said earlier, not everyone is affected by all the NTDs, or rather, NTDs are normally focal. That means you may just find a disease like elephantiasis or lymphatic filariasis is focal in the coastal area. Okay? But using precision public health, you are able to apply multiple tools, combined public health tools, including geographic information system, including meta-analysis and data, to give you a picture of where you are supposed to intervene. And by doing so, we are realizing that we are saving resources, we are becoming more effective, and sustaining that journey, we are going to make management and elimination of NTDs cheaper and quite faster. Yeah, so that's what Amref is doing to address all those domino challenges, which include like people being neglected, people living in poor conditions, people not having access to water and sanitation, less money flowing in terms of investments to the NTDs. Yeah, so we founded ourselves to ensure that those challenges are dealt with through the 5 Ps. Yeah.
Okay. And so we've talked about the 5 Ps and overcoming NTDs. And we've briefly talked about how we are educating communities in terms of NTDs and how to prevent them. But Juma, can you tell me any data-driven policies, not interventions by Amref, that have come into place to help communities in hard-to-reach areas access information about NTDs?
Yeah, so because reaching communities sometimes it's tricky. And I know at Amref we have got some mobile platform solutions that we normally utilize. In the last two or 3 years, at Amref we've been able to work closely with the mobile service providers, and we've been able to generate data for the key focal persons within the communities. Those are the CHPs, the CHVs, the community health assistants, the public health officers, the disease surveillance, and even the clinicians in the communities to generate educative messages through SMS that will be able to go to those communities and create awareness in terms of the diseases. Of course, these diseases are for specific regions. So if you are talking about, let's say, bilharzia or intestinal worms, then you target specific regions. So you send these messages for them to know about how to know about the symptoms of the diseases, how to prevent, how to promote good practices, and also how to manage the diseases. Of course, even at Amref, we have got also learning platforms, LEAP and Mjali, that healthcare workers are also trained on how they are given modules on how to manage these particular diseases. And even more recently, to create even more awareness in the communities, we've looked at also some interactive platforms like puppetry, that you could be able to develop these particular tools, and then you are able to share online with various community members, including schools and community members, health facilities, to be understood in a more interactive way, because also we realize that children like things that they can interact with. So if you use puppetry, then you realize that they are able to pick the details, and they are able to, those animations, and they are able to learn these things. And even the other day, we also worked with our Kill Kids platform, so that we could be able to reach a wider audience in terms of reaching more and more populations. So we are running sessions on our Kill Kids on NTDs. We've been able to pilot this on intestinal worms first, and bilharzia, so that most of the household members, and we know that even within the households, when kids are at home, they are the ones who run the TVs. So basically, they will be able to redirect even their parents to watch that particular program. So when kids are watching this program and they learn about these diseases, and the parents are also able to put in place corrective measures so that we are able to address these particular diseases. We are still exploring more ways through which we can, because the world is moving towards the digital space. So we are still working through ways to see how we can be able to make this more accessible to as many people as possible. Of course, we've also been able to do the TV talk shows, that we are able to reach more people on NTDs, and health talks on radio, so that more people can be reached.
That's really good information, especially about the Jibu platform and the Mjali platform. I've heard a lot about it, but having those snippets of information has really helped my understanding anyway of now how these platforms are not only working with the community, but also working with community health professionals and giving them the tools to now mitigate NTDs in Kenya. And so, Dr. Muchangi, you've talked briefly about strategic partnerships and how they play a role in mitigating NTDs. But now specifically, how do strategic partnerships play a role in Amref Health Africa's efforts to mitigate NTDs? And could you share some examples of collaboration and their impact in Kenya?
Yeah, sure. So at the heart of the partnership is the partnerships for NTD elimination, is the communities. And because that's where things happen, if you want people to keep clean, if you want people to maintain hygiene, to ensure that they are eating food which is not contaminated, it is the communities who have to get that knowledge and who have to change their behavior and practice it. So we partner with communities and we've developed materials which help them to understand the complex scientific knowledge in the easiest way. So partnering with the communities is the first thing. The second piece is the government. The duty bearer of ensuring the health of communities and its people is the government. And so we work with the government both at the national and the subnational level in a very close way. At the national level, we are supporting and working with the government to develop apt policies that then ensure that they start clear guidelines about how things are supposed to be done, be it capacity building, be it surveillance, be it treatment, and all those kind of activities which are done. So that's the other, strong partner. And at the county level, I'm so happy that now we are getting into transformational kind of partnership whereby we bring our knowledge, we bring our technical assistance, but the government is now increasingly investing in ensuring that there's money for drugs, ensuring that there's the healthcare workforce that is available to advance and treat the diseases and all that, yeah? So, the government as a partner. Then the other partner is the donor community. I'm so happy that right now, Amref is working very closely with the CIF to strengthen the health systems to address issues of NTDs. I'm so happy that we are working with the End Fund to bring forth novel tools and systems that can address NTDs easier and faster. And at the same time, we are working very closely with the World Health Organization, first of all from the policy platform, and they are also direct investors with us, yeah, bringing money. So those are resource partners, the money resource partners who are helping us to operationalize that journey. At the end of the day, Amref doesn't see itself as a solitary actor, as a civil society. So we are in partnership with other civil societies to implement this NTD elimination agenda. And those civil societies include partners like AAHD, partners like Wash Alliance Kenya, and many others, on-ground CSOs, to make sure that we aggregate the voice and amplify it together. Yeah.
Okay. And we've talked about the Amref strategy and how it's aligning and contributing to reducing neglected tropical diseases in Kenya. Do you have any final statements or anything you'd both like to add?
Yes, I could simply say that the journey towards eliminating NTDs is practical, it is possible. It's doable and we will do it. Only and only if we follow the imperatives of 5 Ps, which I spoke about. Then number 2, if and only if we ensure that we bring the communities to be at the center of this fight. And lastly, if and only if we ensure that the government is actually held accountable to do its work. If we do all those things and then people start with appropriate resourcing and being efficient and effective in utilizing those resources, we are going to get there. Allow me to paint a picture that we have a vision. And the vision is that by the year 2030, nobody will be talking about NTDs anymore. So we have set ourselves to that ambitious journey, and we do call upon every partner or any entity which can support us towards getting to that vision.
Okay, thank you so much. And Juma, do you have any final words?
Yeah, so just also to add on what Dr. Martin has talked about, in aligning with the Amref strategy, of course, which also coincides with the WHO roadmap for 2021-2030, and the recently launched NTD master plan at the ministry. We are looking at a few issues that will be critical for us to achieve, that will be imperative for the strategy to be achieved. One, the issue of financing. So we are working closely with the counties that we are working with to ensure that they have been able to budget for conducting entity-related activities, and this we've been able to influence policy issues at the counties to an extent that counties have been able to put now funds within the CI, or rather they have been able to include entities spelled out, well spelled out within the CIDPs, and by so doing, then it means the counties will be able to allocate funds. The issue of partnership that Martin has talked about, we are looking at expanding our scope so that we can be able to bring more players on board and directly involve communities, because we are looking at issues of, we are also trying to novel some strategies to see if we can be able to integrate. Of course, in most cases, entities have not only been neglected, the people, the way Martin was saying about the people, they have also been neglected within the health system. So they are not part of the routine health system care that the government provides. So we are looking at how we can be able to integrate these entities within the health system, so that as the government rolls out health-related activities at the community level, entities will be part of the discussions on the table.
Excellent and excellent. Thank you, Dr. Martin Muchangi and Chivitai Juma, for your invaluable insights and for enlightening us on Amref Health Africa's innovative approaches to tackling neglected tropical diseases. Your expertise underscored the vital role of community engagement, education, and enhanced healthcare access in fighting NTDs. These efforts not only improve health outcomes, but also empower communities with essential knowledge and tools for better health management. To our listeners, thank you so much for joining us in this critical conversation about NTDs. This has been Halima Sabo, your host. And if you have any questions, concerns, or wish to be part of our ongoing dialogue on NTDs and people-centered health systems, please connect with us on our social media platforms. And so these are Twitter, which is at Amref_Kenya, Facebook, which is at AmrefKE, and Instagram, which is #AmrefKenya. Remember that together we can make a significant impact in conquering neglected tropical diseases in Kenya and beyond. Goodbye for now.